The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
Hi, this is Dr. Thomas O'Brien. For almost 25 years, I specialize in offering families an affordable concierge service to avoid paying costly medical insurance or unreachable deductibles without giving up premium health care. As an osteopath, I offer osteopathic adjustments alongside medical examinations. Also, I offer discounts to military and first responders. I am now accepting no-fault patients, which include osteopathic adjustments, medical treatments, and prescription services, including medical marijuana. At my practice, my patients never pay copays and still receive the most personal and complete medical care. I have spent my career devoted to providing healthcare at affordable prices. Everybody should have a relationship with their physician. I work for you and your family. The honor and privilege is mine. If you have been in an automobile accident, please call my office at 631-980-8200 for an immediate appointment. To learn more about me and my practice, visit drtomio.com. Again, I am accepting no-fault patients. Call my office for an immediate appointment, 631-980-8200. Welcome to the X Dr. Tommy O Show. I'm your host, Dr. Thomas O'Brien. The X Dr. Tommy O Show can be heard every Wednesday at 4 p.m. on 103.9 LI News Radio. I offer a very affordable concierge practice which allows you access to the quality care you really deserve. With no rush office visits, both you and I can discuss your healthcare needs. As your primary care physician, it is important for me to have a baseline knowledge of your health. This way, when you come to my office not feeling well, knowing your history allows me to properly diagnose and treat your illness. Call my office today and schedule a history and physical. If you wait, it may be too late. If you're involved in a no-fault motor vehicle accident or have what's called no-fault insurance, call my office today. I can treat you with osteopathic manipulative medicine. All right, to my military family, I got your six. To my Masonic brothers, the light is bright. I'd like to please welcome Sammy Vanny, my co-host.
How you doing? How are you, Dr. O'Brien?
All right. How are you today?
I'm good. It's good.
Everything well?
Everything's well.
How's the family?
Everyone's good.
Everyone's good?
Mom's good. Lucy's good.
You want to say hello?
How you doing, guys?
That's it. All right. Today's show, osteopathic manipulation, or what's also known as osteopathic adjusting. I'm using adjusting because that's a term that you're familiar with. So osteopathic adjusting.
For the next month, we're giving away 50 vouchers for a full body adjustment, including a detailed physical and spinal examination, along with a personalized adjustment treatment plan, all for just $49, normally a $250 total value. This is a limited time offer as we have had a lot of interest, so we encourage you to call the office today and schedule your appointment. We look forward to serving you.
Yes, that's an important message right there. I decided to start marketing I used a company and we came up with a nice campaign. Right now it's on Facebook and Instagram or with social media, but now I'm going to announce it on the radio. So if you suffer from chronic neck and lower back pain, or you've been to, say, another osteopath or chiropractor, or you're new to the area and you used to see a chiropractor or an osteopath, come to me. I'm offering this service, again, for $49 for the first 50, okay? For the next month, we're giving a voucher, $250 value for only, it's actually $49, the actual fee, and you get a full examination. That's a thorough history and physical, and then a structural exam. All right, so I look to service you, get to know you, learn more about you, and so we can help make a difference in your life. I always say a happier and healthier you. All right, so let's get into today's show. Again, osteopathic manipulation or osteopathic adjusting, because that's the term that everyone's familiar with.
Alrighty, so we'll start off with a few questions. Who developed osteopathy?
Yep. We're going to start off with our founding father, and the founding father is Dr. A.T. Still. That's Andrew Taylor Still. He was he was not an osteopath. He was an allopath, an MD, and he felt that there had to be a better way, which we'll continue with the next question.
Alrighty. When was osteopathy developed?
Yes. Dr. A.T. Stoll, he served in the Civil War. Actually, we go one generation before that, his father. Dr. Stoll's father was an allopathic MD, and he followed in his father's footsteps. What he did was back then there was apprenticeships, and you can become just like we have today. You do an apprenticeship, and then you are granted a license, and you go out and you can start practicing in your discipline. Well, it's the same thing back then. With medicine, it's a little bit different because you have to be accepted into medical school, and then we do an internship, residency, and you sit for your boards, and you get practice. But back then we did not have that. So he did an apprenticeship under his father, and then he served in the Civil War in the medical unit while he was in Kansas and Kentucky there, and Missouri as well, serving those community. And he felt there had to be a better way because he saw a lot of deaths, especially in his family. He lost a few children to illness. And he felt that there had to be a better way other than giving toxic medication, basically mercury-based or toxic medication for treatment. And what he did was after the Civil War, he went and looked at the anatomy and saw how medical conditions in the body are interrelated. And he said that there has to be a new system. And he came up with a new system where the body and the structure, the actual skeleton and the nerves and the arterial vascular system are all involved, and which we're going to go into the tenets because I'm holding back on that information so I can discuss that, where they work together and they make individuals healthy, and he developed a new concept. And this concept he brought to other medical schools to start to apply this new philosophy, and he was rejected. And then he applied for a medical license to open up his own medical school, and he was granted that in Missouri, and he opened up a school in Kirksville, and that's the first school of osteopathic medicine, and that's where he started teaching his new philosophy.
Alrighty, why was osteopathy developed?
Okay, it was out of necessity. Again, failed treatments. After seeing the devastation that occurred with the Civil War and after, he felt there had to be a better way. Now, you had the soldiers; they lost limbs, and you had the amputations. It is said that a lot of the soldiers survived this surgery. However, they did not survive the surgical infections. And so he felt there had to be a better way, and that's when he sat down, went into the anatomy lab and kinesiology lab, and he came up with a new philosophy, basically looking at structure as function. And I always say that in almost every one of my shows, structure as function, which we'll discuss shortly.
All right, so next question. What are the different tenets of osteopathy?
All right, so this is important, This is our core philosophy, all right? And this is developed by Andrew Taylor Still, There is 4 tenets, 4 tenets. The first one is the body is a unit. The person is a unit composed of mind, body, and spirit. I believe in this, the mind, body, spirit, the mind, body, soul. You must have all 3 components working together as one in order to be healthy. If we have one that's off kilter, if you will, you're going to have an unhealthy state. So the key is to treat the person as a whole, as a complete individual. Allopathic medicine, MDs, their philosophy is to looking at a cellular level. Our philosophy is we look at the person holistically, and we take a holistic approach. Therefore, the treatment shall include the body as a whole. The second tenet, the body is capable of self-regulation, self-healing, and health maintenance. So the body has an innate ability to heal itself. The third tenet, I always say this, structure and function are reciprocally interrelated. If any body structure is out of place, injured, or otherwise not working properly, the body will perform not at its best. Manual osteopathy can assist with spinal alignment, joint and bone disorders, blood circulation, tissue oxygenation, and nervous system disorders. Now, I always say structure is function. Without proper structure, there is no function, rather dysfunction. And we know this because if you look at other diseases, and if we look at the structure, there's a change in that structure. Okay? And what happens is we have a disease state. It doesn't matter what part of the body, we end up having a disease state. And that's what we're talking about here. All right, so I have 30 seconds left. We're getting ready to shut down part 1 of our show today. Would you like to say something?
I love doing this.
You love doing this? So do I. That's why we're doing it. I love educating. I've been doing this for 30 years. Actually longer because I was a high school teacher before I entered medical school. All right. To learn more about my practice, go to drtomio.com. That's drtomio.com. Or give my office a call at 631-980-8200. If you're involved in a motor vehicle accident, you need a physician, call my office today. I am accepting no fault. Also, look up $49. You get a structural exam. Welcome back to the Dr. Tommy O Show. I'm your host, Dr. Thomas O'Brien. The Dr. Tommy O Show can be heard every Wednesday at 4 p.m. on 103.9 LI News Radio. I offer a very affordable concierge practice, which allows you access to the quality care you really deserve. With no rushed offices, both you and I can discuss your healthcare needs. As your primary care physician, it is important for me to have a baseline knowledge of your health. This way, when you come to my office not feeling well, knowing your history allows me to properly diagnose and treat your illness. Call my office today and schedule history and physical. And if you were involved in a motor vehicle accident, call my office today. I'll do a thorough exam, and I can start treating you with osteopathic manipulative medicine. I want to welcome back Sammy Vanny. How are you?
I'm good.
Part 2?
Part 2.
Part 2. All right. Today's show is osteopathic manipulation or osteopathic adjusting, a term that you're more familiar with.
For the next month, we're giving away 50 vouchers for a full body adjustment, including a detailed physical and spinal examination, along with a personalized adjustment treatment plan, all for just $49, normally a $250 total value. This is a limited time offer as we have a lot of interest, so we encourage you to call the office today and schedule your appointment. We look forward to serving you.
All right. So if you suffer from chronic neck and lower back pain and you're just not sure what to do, or who to go to, or if you went to your primary care physician and not sure what the issue is, give my office a call today because I can do a thorough physical exam and a structural exam. It's important. Allopaths, MDs, they're not trained in a proper way to do a structural exam, okay? Because this is something that Dr. Still, A.T. Still, who we're discussing, he developed a structural exam specifically to find what we call somatic dysfunctions. And somatic dysfunctions are what we have changes in the muscle skeletal system, and that's what we correct when we manipulate. All right, so the first half we ended with, and I still have one more tenet. We were discussing, who developed osteopathy, and that was Dr. A.T. Still, Andrew Taylor Still. He was originally MD, and he came up with a new philosophy, felt there had to be a better way. It was developed because of out of a necessity, and this was in the mid to late 1800s, and it took about 14 years of really studying the anatomy and coming up with a new philosophy. And we'll continue with the tenets. Why did you develop it? Like I said, out of a necessity, because back then we used very toxic medications. Pharmacology 101, all drugs are poisons. We just control the poison for a specific function. Literally, it was poison back then. All right. So we started discussing the 4 tenets, and these are what Dr. Still came up with, his philosophy. The first was the body as a unit. We're looking at the patient as the mind, body, and spirit, or the mind, body, and soul as a complete unit. We don't separate the individual out as like just at the cellular level. We're looking at individuals on whole or as whole. Okay. The second was the body is capable of self-regulation, self-healing, and health maintenance. What we say, the body has the innate ability to heal itself. The third tenet, this is my favorite, structure and function. They're reciprocally interrelated, meaning structure is function. Without the proper structure, there is no function, or what we call dysfunction. And in every medical condition, you will see there's some sort of structural change, some sort of dysfunction in the body which led to diseased state. And this is what Dr. Still was talking about. The fourth, which we're going to introduce now, it's rational thinking, okay? The way you approach medical conditions, medical pathology, rational thinking. Manual osteopathic treatment is based upon an understanding of the basic principles of the body functioning as a whole, its ability to self-regulate and reestablish homeostasis, and the interrelationship of structure and function. Again, it's a holistic approach. All right, the mind, body, soul, the mind, body, spirit. In my practice, I really embrace this. People come in, I get to know them, right? You've seen me in my office.
Yeah,
right?
We have full conversations all day long.
Right? But I treat it's not what are you here for, but I want to know more about you, right? I want to know how your family's doing, how's things going, how's work. I need to understand what your mindset is so I can take a proper approach so I can address your condition, because it might be something as simple as making a quick change and not necessarily like a behavioral change or discussing coping mechanism rather than pushing a pill.
I always know to clear my schedule with Dr. O'Brien because I end up spending hours there.
That's it. All right.
So I'm actually intrigued by the next question because I don't know the difference. What is the difference between osteopath and a chiropractor?
Yes. Okay. Well, there is a big difference. An osteopath, we are medical physicians. Okay. So we are a medical doctor, medical physician. The medical doctor, that's a global term or an umbrella term. And underneath that would be what we call allopaths. And behind their name, the initials would be MD, medical doctor. And actually, if we existed back when allopaths were first beginning, they would really be DA, a doctor of allopathy. But because we didn't exist, they took the initials MD for medical doctor. And then behind my name, you'll see DO, doctor of osteopathy. We are both doctors. We both go to medical school. The same exact tests, the entrance examinations, the applications, we go through the same process, 4-year degree, the MCATs. We do 4 years of medical school. The difference between us, osteopaths, and allopaths is the fact that we study the musculoskeletal system, osteopathy, which one, it's not part of their philosophy, so they don't teach it and they don't believe in it. And then the rest is exactly the same. Same books, Morrison Boyd and all the anatomy, and nothing is different other than the osteopathy, the manipulation aspect. We do a residency, then we can specialize. You can be like I specialize in family medicine, or if you want to go into surgery, you can go into surgical disciplines. Chiropractics, they are not medical doctors. They are doctors, but they go to chiropractic college. They don't go to medical school, so they go to chiropractic college. They do have, entrance requirements. A lot of their requirements are similar to ours, if not exactly the same, but there's a few more that we need. They do not take MCATs, and they apply. If they have the grades, they have the letter of recommendations, and then they get an interview, they can get accepted into chiropractic college there. Out of all three, allopathic, osteopathic, and chiropractic, the osteopaths we're the only complete physician. What I mean by is I can prescribe medications, I can perform surgery as well as manipulate. Allopaths, they can only prescribe as well as perform surgery. They cannot manipulate. Chiropractors, they can only manipulate, or what they call adjust. They cannot prescribe medications nor perform surgery because they are not medical doctors. So that is the difference between the three.
I might become a chiropractor now. Can you write my recommendation letter for me?
There you go.
All right. So, is there a difference in terminology between osteopaths and chiropractors?
Yes, there is a difference. We're both describing the same exact what we call lesions, but we just used different terminology. When I first started medical school in 1990, we used to say osteopathic lesion. Starting in 1991, the terminology changed, and so we started calling it somatic dysfunction. And that is where we have a change in the structure, and that's what we correct. With chiropractors, the term that they use is subluxation. Now, let me just go back one step. The founding father, Daniel Palmer, D.D. Palmer, he was a student of A.T. Still, and he decided to go out on his own, and then he started chiropractic, and that's the term he used, and he started his first school in Iowa in Davenport, and then his son took over from there.
Is there a difference in adjusting techniques?
The original techniques are what we call Stills techniques, okay? And you'll see the thrusting techniques. There are differences because we have Dr. Fryette and other physicians that advanced osteopathic techniques. And then there's exclusive chiropractic techniques that we don't learn because they were already separated from us. So there are differences in the techniques and the approach as well. All right, so we have 25 seconds left on the second half of the show. Would you like to say anything?
Thank you for having me again. I love doing this.
Yeah, well, I wanted to be a part of this. This is important. All right, so to learn more about my practice, go to drtomio.com. That's drtomio.com, or give my office a call. It's 631-980-8200. Call my office today and schedule an appointment. I look forward to taking care of you.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.